Psoriasis is not just a skin condition, it is an immune storm, fueled by overactive T cells and pro-inflammatory cytokines. But today, science offers hope. Treatments now target the disease at every level, from creams on the surface to light that reshapes immunity, to biologics that shut down the storm at its core. Because psoriasis is chronic, visible, and systemic, treatment must do more than clear plaques. It must improve quality of life, restore comfort, and address the disease's deep inflammatory roots. Topical agents remain the cornerstone of care for mild to moderate psoriasis. They work directly on lesions, with minimal systemic side effects. Corticosteroids are the most common, reducing inflammation by blocking cytokines. Potency matters. Strong steroids provide fast relief, but long-term use can thin the skin or lose effectiveness. Vitamin D analogs like calcipotriene slow down keratinocyte growth and modulate immunity. Combined with corticosteroids, they enhance results while reducing side effects. Topical retinoids like tazarotene normalize cell turnover. Calcineurin inhibitors, tacrolimus and pimecrolimus, are especially useful in delicate areas like the face or groin, avoiding steroid-related thinning. Traditional therapies like coal tar and anthralin reduce scaling and slow growth, though their odor and staining limit use. Still, they remind us of medicine's long battle with this condition. For centuries, sunlight has calmed psoriasis. Today, phototherapy refines that approach, especially with narrowband UVB light. NB-UVB therapy exposes the skin to controlled wavelengths of 311 to 313 nanometers. It induces apoptosis of overactive T cells, reducing inflammation and normalizing keratinocyte growth. Within weeks, plaques shrink and fade. PUVA combines psoralen, a light-sensitizing drug, with UVA exposure. It slows cell turnover and modulates immune pathways, but side effects like nausea and long-term cancer risk make it less common today, often replaced by NB-UVB. When psoriasis spreads widely or resists topicals, systemic therapies step in, drugs that calm the immune system throughout the body. Methotrexate, one of the oldest systemic agents, inhibits DNA synthesis, slowing down rapidly dividing T cells and skin cells. Effective but demanding, it requires monitoring for liver, blood, and gastrointestinal side effects. Acitretin, a retinoid, helps normalize skin cell development, especially in pustular and erythrodermic psoriasis. But because it can cause birth defects, it is not suitable for women of childbearing age. Cyclosporine works quickly by halting T cell activation. It brings dramatic improvement, but long-term use risks kidney damage, hypertension, and increased cancer risk. A newer oral agent, apremilast, blocks phosphodiesterase 4. It dampens inflammatory cytokines with a favorable safety profile, especially for patients with multiple comorbidities. Biologics have revolutionized treatment. These lab-engineered antibodies block the very cytokines that fuel psoriasis, TNF-α Illinois, 17 and IL-23. Anti-TNF agents like etanercept, infliximab, and adalimumab were the pioneers, reducing inflammation across the body and bringing rapid skin clearance. Next came IL-17 inhibitors, secukinumab, ixekizumab, and brodalumab. By targeting the cytokine most responsible for keratinocyte overgrowth, they achieve clear or nearly clear skin in a majority of patients. IL-23 inhibitors like guselkumab, tildrakizumab, and risankizumab block inflammation at its source. They allow for sustained remission and longer dosing intervals, bringing relief with fewer injections. Biologics are powerful, but not without risks. Infections, reactivation of tuberculosis, and rare malignancies are possible. Careful screening and follow-up are key. Still, for many, biologics offer life-changing results. The future of psoriasis care lies in precision, matching treatments to genetics, lifestyle, and comorbidities. Personalized medicine promises to move beyond one-size-fits-all into therapies tailored for each individual. From creams to light, from pills to biologics, treatment for psoriasis has come a long way. What once felt like an untouchable burden is now a disease increasingly managed, even controlled. And as science advances, so too does hope.